Hi, I'm Erin Hicks.
And I'm Catherine Nottage.
And we're physical therapists at the West Texas Rehab Center. Do you or anyone you know suffer from vertigo, dizziness, imbalance, or anything else related to those issues? Many people don't even realize that there's anything that can be done about those things. We hear all the time that people have just been living with those things for years because they didn't realize anything could be done. They're leaving activities out of their normal daily lives that they would like to be doing, and they're just miserable because they don't realize that there is something they could be doing. We have certified vestibular specialists at the West Texas Rehab Center that can do extensive and individualized evaluations to help assess and figure out where your symptoms are actually coming from, so that then we can develop a really personalized program to help treat those things and hopefully help you to get feeling better soon. Catherine, why don't you list some common symptoms that people might experience with these issues?
So we see several patients coming in with generalized dizziness. So that can mean several things, such as the room is spinning or you feel like you're spinning. Sometimes the environment seems kind of like it's bouncing, so difficult for you to focus on objects or read certain things like road signs. Sometimes it can just be lightheadedness, which is related more to a blood pressure issue possibly. Anything like this, also just general balance. Your vestibular system is about a third of your balance system, so if there's any impairment there, then it's going to throw you off balance with your daily activities.
And talk to us a little bit about maybe some common causes of some of these symptoms that we might experience.
Yeah, so you can have issues with the inner vestibular system, peripheral or central vestibular system. As I listed, vitals can play into it, so low heart rate, low blood pressure, high blood pressure, anything related to that. Any type of blockage in an artery, such as carotid arteries or vertebral artery in your neck, can cause some dizziness, as well as cervicogenic dizziness, which is any issues related to the cervical spine, so in your neck area too.
We have a wide variety of treatment approaches that we can use. This includes hands-on treatments, possibly positional treatments, and even exercise activities to help get you back on track. We also have state-of-the-art equipment that we can use to help aid in our testing to determine what's wrong with you, just like these video goggles here. Catherine, talk to us a little bit about BPPV, one of the most common things that we experience.
So BPPV stands for benign positional paroxysmal vertigo, which is basically a long-term meaning that you get dizzy with certain positions. So the cause of that can be multiple things, sometimes falling and hitting your head, like post-concussion, or sometimes comes on just randomly, you wake up with it. Generally, severe room spinning dizziness that lasts just briefly, maybe associated nausea or vomiting with that too. The nice thing with this is it's pretty easy to treat. So just a few treatment sessions involving different head positions to kind of roll crystals through a specific canal can resolve those symptoms quickly and get you back to your normal routine day to day.
Yeah. And if weakness in your vestibular system, or maybe weakness in the connection between the inner ear and the brain, is an issue that we find in our testing, then we have a series of several different exercises that we can incorporate into some other things that help promote habituation, adaptation, and substitution. Basically, that means we're trying to do a repeated exposure to reduce the stimulus that's causing your symptoms, possibly trying to strengthen some of the systems that are weak or are not maybe functioning at full capacity, and also trying to incorporate other systems in your body that may need to jump in and kind of help out where there is weakness there. If you or someone you know could benefit from our expertise at the West Texas Rehab Center in this vestibular category, feel free to reach out to your doctor and ask more questions, and try to come see us here at WTRC. We will do our best to take great care of you.